Hello, this is Dr. Tolliver with Galleria Dental. If you're reaching us on the emergency dental page, you probably are having some concerns right now. So I'd like to go over some of the most common dental emergencies and what you can do about them right now. The first thing you can do is assess the situation. Usually the dental emergencies that I hear of are people that have had a trauma injury. Maybe they're playing basketball and caught an elbow in the mouth, or they fell going down some stairs and knocked a tooth out, something along those lines. So the first thing is to assess the situation. If the tooth is outside the mouth completely, like the whole tooth is outside the mouth, one of the things that you're going to want to do, and it's in a clean, sterile environment, is to rinse it with either saline, or if it's very clean, you can actually put it in your mouth, but you want to try to replace that tooth as soon as possible. And so if you're out in the field and you're by yourself and you don't have anybody to help you, then you may have to try to make sure it's clean. You want to make sure it's clean before you put it back in your mouth, but you want to try to replace that tooth. That's probably one of the quickest things. And a tooth that is avulsed, we call that, and outside the mouth, can be replaced and can stay in your mouth. So, but you do have to assess it, and it does take a little bit of skill level. If it's in a gymnasium and there's a lot of people around, hopefully there's a dentist or a dental hygienist or a dental somebody you can call around that could help you accomplish that. The next best thing you could do would be to put it into like a cup of milk, or to put it in your mouth, like I said, in your cheek to where your saliva is on it. Those are a couple ways that you can kind of preserve it, but you don't want to rinse it with water. Water is does not have the right salt value in it. It's not saline. It will pull and dry out the tooth too much. And so you're better off to put it in milk, or in saline would be good. And they also make some tooth solutions that sometimes gyms will keep. Like if you're at a basketball game, sometimes the trainer will have a solution there for a tooth to put into. But if you're going to go that route and you place it in the thing and you're not comfortable putting it back in, or there's concerns about the dirtiness of the tooth, put it in there and call your nearest dentist, or call our office, and we'll hopefully guide you the right direction. The other option is, if it's late at night, all dental offices are closed, would be to go to the hospital. But if you can transport that tooth inside something that will keep it preserved, then that tooth may still be able to be used. So that would be the number one kind of thing that could happen, and could be also corrected. Now, the majority of the time that I see, teeth don't come out completely all in one piece. They come out in multiple pieces. So you break off the tooth, you've got, half the tooth is in your hand and half the tooth is still in your mouth. That's a little bit trickier to treat, because I would still hold on to the tooth that's broken. We can use that. Sometimes we can rebond that, or sometimes we can use it as a guide, for your new tooth, at least for the shape. And so if we're building back another tooth, we can use that as a guide to shape that new tooth. But that's going to be a little bit trickier to treat, and you're going to need to see a dentist. As far as things getting worse, that's one of the things people are always concerned about when they call me is are things going to get worse? Usually not. And a lot of times with these injuries, there's more trauma to the area as well. If you get hit with something in the face, not only did it break your tooth, but it also cut your lip and cut all your soft tissue. So typically seeing an oral surgeon or seeing the emergency room, if you need to have any stitches or anything like that, is the first place you'll go. The teeth we can usually correct and fix later if they're broken off. It's not something that's going to get worse over time. But the only thing that's really an emergency that requires immediate, quick attention is if you have a completely avulsed tooth, like we talked about before, the tooth coming all the way out of the mouth. You want to try to replace that as soon as possible, either yourself or with the help of a dental team. And transporting that tooth and keeping it in either milk or salt water or some kind of tooth solution, that's the way to go. So if there's any other questions, feel free to reach out to our office or explore more of our website. But hopefully you find a way to treat your dental emergency. Thank you.